Good afternoon, ladies and gentlemen. My name is Babak Shokati. I'm from University of Toronto. I did my master's in dental materials and also my prosto training in University of Toronto. And currently I'm teaching there. You can find me here doing all-time dentistry. One of my friends actually made this funny Photoshop, and I really like it. Anyways, for today's, I'm going to talk about the level of treatment planning, as Mario was talking about, and then the rationale behind all-on-4 treatments. Now, the main aim of this presentation would be providing a knowledge base for clinicians, for you clinicians, to see if you can offer this sort of implant-based treatments for your patients in your practice, and of course, you can increase and improve the quality of life for your patients in your practice. I will start with the standard edentulism, as Mario was explaining, is considered a disability, and patients based on the definition of WHO are considered disabled. And although there is no causal or association between poor health and edentulism, but there are a lot of evidence showing that the existence of poor health can be coexistent with the edentulism. So either it is an association or not, we can see them at the same time, and this can be a sign for us, dental service professionals, to increase and enhance the life of our patients. And more than half of the Canadians above 65 years old are edentulous, and it is up to us to improve their life, the quality of life in these patients. Now, the standard problems with conventional dentures, we all know about that. We know that dentures are not stable. They cover mucosa. They decrease the masticatory efficiency. We know that patients are not happy in general with the complete dentures. Now, I mentioned that mostly because I wanted to tell you about the way that P.I. Brannemark interpreted that, having this in mind that P.I. Brannemark is an orthopedic surgeon. So he is saying that edentulism and an edentulous patient is just like an amputee. It is an amputee. And he is pointing out that the world of medical services are not paying enough attention to edentulism because, well, teeth are very important in patient's life, and it is exactly equal to amputism. Now, to solve the problem, P.I. Brannemark has introduced implant dentistry. With implant dentistry today, we are able to predictably solve a lot of problems, biological, functional, emotional problems of the patient associated with using complete dentures. Now, just to summarize everything, we have an edentulous patient. We want to restore and rehabilitate this patient. What are the options? We know that dentures, obviously, and then implant-assisted prostheses, different types. Mario was going through it, and we have the simple, from a simple 2-implant overdenture goes to more elaborated, more complex designs, 4, 6, whatever implants, and then detachable complete denture, or